Welcome to Prime Senior Living. Today we explore a life-saving dialogue between two centenarian legends regarding the critical moments of a stroke. Dr. Howard Tucker and Dr. Shigeaki Hinohara share wisdom not just on longevity, but on surviving the sudden onset of a brain attack. When a stroke strikes, every single second counts. However, panic often causes us to make mistakes that accelerate the damage to our brain. The goal of this video is not to replace emergency medical services, but to teach you how to protect your brain while waiting. We must understand what happens inside the skull. Your brain cells do not die immediately. They gasp for air like a drowning person. Dr. Tucker emphasizes that our immediate reaction determines whether these gasping cells will survive the trauma or be lost forever to the darkness. The ambulance is coming, but it might take 10 or 20 minutes. Those minutes are the battlefield where the war is won. Most people fall into the trap of panic, which increases heart rate and oxygen demand, effectively suffocating the brain cells that are struggling. Dr. Hinohara suggests that we must treat the brain with extreme gentleness during this crisis, reducing its workload to the absolute minimum possible. Imagine a river blocked by a stone. The water flow is restricted. Downstream, the land is drying up and needs immediate conservation of water. This biological crisis is about supply and demand. The supply of oxygen is low, so we must aggressively lower the demand immediately. By controlling our physical state, we can lower the brain's metabolic rate, buying precious time for the medical professionals to arrive and help. This is not magic, it is physiology. We are trying to protect a specific area of the brain known to doctors as the penumbra. Let us dive deeper into this concept. Understanding the penumbra is the key to understanding why staying calm and lying down is crucial. When a stroke happens, the core area of the blockage dies quickly. However, the surrounding area is the battleground we can actually save. This surrounding area is the penumbra. It is stunned and starving for oxygen, but the cells there are still alive and salvageable. Think of these cells as a flickering candle. If you run or panic, the wind blows it out. If you shield it, it survives. The penumbra can survive for hours if the demand for energy is low, but if demand is high, it dies in mere minutes. Dr. Tucker and Dr. Hinohara agree that the patient becomes the first responder. Your actions in the first 10 minutes dictate the outcome. Tragically, the instinct for many is to stand up, walk around, or splash waters on their face. This is the worst possible reaction. Standing up forces the heart to pump against gravity. Panic releases adrenaline. Both of these things burn through your remaining oxygen reserves instantly. You must override this instinct. You must stop moving immediately. Do not walk to the car. Do not walk to unlock the door. Instead, we must adopt a specific posture that utilizes gravity to assist blood flow and reduce the pressure inside your skull. This is the side-lying position. It is the gold standard for stroke safety while waiting for an ambulance. Let us analyze why. Lying flat on your back is dangerous because the tongue can block the airway. Lying on the side keeps your airway completely open. Furthermore, if you vomit due to stroke nausea, lying on your side ensures the fluid drains out, preventing choking or aspiration pneumonia. But the most critical benefit is venous drainage. This position helps blood leave the brain easily, reducing dangerous pressure buildup inside the skull. High intracranial pressure squeezes the delicate penumbra cells. By lying down, you lower this pressure, giving those cells room to breathe and survive. Make sure the head is slightly elevated. This creates the perfect balance between supplying fresh blood and draining old blood from the brain. Dr. Tucker advises that once you are in this position, you must stay there. Do not try to get up to check anything. Call emergency services immediately. Put the phone on speaker and place it next to you. Now, your only job is to breathe. The second life-saving action is slow nasal breathing. This is the remote control for your nervous system to switch off the panic mode. When we panic, our sympathetic nervous system spikes blood pressure. We need to activate the parasympathetic system to calm everything down instantly. Inhale deeply and slowly through your nose. Nasal breathing increases nitric oxide, a molecule that helps open up your blood vessels efficiently. Fill your lungs completely, but without strain. The key is not just the inhale, but the exhale. The exhale must be longer. Try to inhale for a count of 4 and exhale for a count of 6 or 8. Long exhalation triggers the relaxation response. This breathing pattern stimulates the vagus nerve. This nerve tells your heart to slow down and tells your brain that you are safe. As your heart rate drops, your brain's oxygen demand drops. You are effectively putting your brain into a temporary hibernation or safe mode. Dr. Hinohara practiced this daily. He believed that controlling the breath is the most powerful tool we have to control our physiology. By cooling down the brain's activity through breathing, you extend the life of the penumbra cells. You are buying time with every breath. Combine these two, the side-lying position for blood flow and slow nasal breathing for metabolic control. This is your survival protocol. However, knowing this information is not enough. In a real emergency, panic wipes your memory clean. You must practice mental rehearsal. When the alarm bells of stroke ring, logic shuts down. Unless this sequence is automatic, you will likely forget it and stand up. Athletes use visualization to perform under pressure. Seniors must use it to survive. You must vividly imagine yourself having a stroke. Practice this physically once a week. Lie on your floor or bed. Roll to your side. Dial the phone. Control your breath. By practicing when you are calm, you build muscle memory. Your body will remember what to do even if your mind is frozen. This creates a neural highway in your brain. When the crisis hits, the signal will travel down this highway automatically, bypassing the panic. Dr. Tucker and Dr. Hinohara want you to be prepared, not scared. Preparation is the ultimate form of protection for your future self. Let us recap the protocol. First, drop to the floor safely. Second, lie on your side. Third, breathe slowly through your nose. When the paramedics arrive and find you in this state, you have given them the best possible chance to save your life. You have protected the penumbra. You have saved the brain tissue that allows you to speak, to move, and to hug your family. Stroke is a terrifying enemy, but biology gives us a window of opportunity. Use that window wisely with the power of knowledge. We hope this dialogue between legends helps you feel more empowered. Please share this video with everyone you love who is aging. Remember, Dr. Tucker is still practicing medicine at 100 years old. His secret is not just luck, but smart management of health. And Dr. Hinohara worked until the very end. They are testaments to the resilience of the human body when treated with respect. Your life is precious to your family. Don't let a moment of panic steal your future. Train your mind, save your brain, protect the penumbra, keep the supply high and the demand low. It is a simple equation that makes the difference between life and death. Look at yourself in the mirror today and promise yourself, if it happens, I will not panic. I will lie down and breathe. Thank you for watching this vital presentation on Prime Senior Living. Stay safe, stay prepared, and live your prime life to the fullest. Goodbye for now, and may you never need to use this advice, but be ready if you do. Take care. Let us take a few more minutes to understand the biology deeper. Why exactly does the side-lying position help the heart so much? Your heart is a pump. When you stand, it must fight gravity to push blood up to your brain. This requires massive energy. During a stroke, your brain is screaming for blood. If you stand, the heart works harder, raising blood pressure to dangerous levels. By lying down, you neutralize gravity. The heart can gently push blood to the brain without raising pressure, preventing further vessel bursts. This is crucial if the stroke is hemorrhagic, meaning a bleed. High pressure will make the bleed worse. Low pressure limits the damage. Dr. Tucker notes that we often cannot know if a stroke is a blockage or a bleed without a scan, but lying down helps both. Whether it is a clot or a bleed, the physics remain the same. Reduce the work of the heart, and you protect the brain. Now back to the nose. The sinuses produce nitric oxide, a gas that expands blood vessels. Mouth breathing does not produce this gas. This gas travels into your lungs and widens the vessels, increasing oxygen uptake by up to 20% compared to mouth breathing. Mouth breathing signals danger to the brain. It mimics the panting of an animal being chased. Nose breathing signals safety and rest. We want to shift your brain waves from high-stress beta waves to calm alpha waves. This state preserves energy for cellular survival. Teach this to your children and grandchildren too. It is a life skill that manages anxiety, lowers blood pressure, and saves lives. A critical warning. Do not take aspirin unless dispatched by emergency services. If you have a bleeding stroke, aspirin could be fatal. Dr. Hinohara would remind us, do no harm. Since we cannot diagnose ourselves, we must avoid medication and focus on posture and breath. The only thing you should put in your mouth is air. The only thing you should move is your diaphragm. Stay still. By slowing your metabolism, you are effectively slowing down the clock. You are stretching the golden hour into a golden opportunity. If you are with a loved one, cover them with a light blanket. Shivering burns oxygen. Keep them warm, calm, and reassured. Fear is contagious, but so is calm. If you are the caregiver, your calmness is a medical intervention. Breathe with them. Dr. Tucker says the spouse is often the hero. Your voice, your touch, and your guidance can stabilize the patient's heart rhythm. Incorporating slow breathing into your daily life, like Tai Chi or yoga, prepares your vascular system for unexpected stress events. Regular practice keeps your blood vessels elastic. When a crisis hits, elastic vessels can handle the pressure changes much better than stiff ones. Dr. Hinohara believed in the power of habit. Make safety a habit. Make calmness a habit. Do not wait for the emergency. This protocol is your shield. It is invisible. It costs nothing, but it is stronger than any medicine you have at home. If you are younger and watching this, you are the guardian of your parents. Teach them this. Rehearse it with them tonight. Make it a family conversation. It does not have to be morbid. Frame it as a strategy game where everyone wins. Fear comes from the unknown. By knowing exactly what to do, you remove the fear and you replace it with actionable power. Remember, gravity is your enemy when standing, but your friend when lying down. Make gravity work for your brain, not against it. Remember, panic is the fuel for the fire. Slow breathing is the water that puts it out. Control the fire immediately. The wisdom of the East meets the science of the West. Dr. Tucker and Dr. Hinohara have given us a blueprint for survival. Mark your calendar. Pick one day a week to visualize the scenario. It takes only 30 seconds, but it adds years to life. We want you to enjoy many more walks in the forest, many more birthdays, and many more precious moments with your loved ones. Your breath is the anchor. In any medical emergency, if you can control your breath, you are already winning the first battle. Dr. Tucker sends his regards and reminds you that age is just a number, but preparation is a choice you make every day. Dr. Hinohara's legacy lives on through this advice. He served patients until he was 105. Let his dedication inspire your own self-care. Share this knowledge with your community. A prepared community is a safe community. Let us watch out for one another. Technology can help too. Set up your medical ID on your phone. Make sure your emergency contacts are just one button away. Let fresh air into your life. Keep your environment calm. Reduce clutter that could cause falls. Create a safe sanctuary for yourself. Stay hydrated. Thick blood clots easier. Drinking water is the simplest blood thinner you can take to prevent strokes before they happen. Prevention is always better than cure. But if prevention fails, the Penumbra protocol is your safety net. Trust in your body's ability. Treat your heart and brain with love. Do not subject them to the violence of panic. Treat them with the gentleness of breath. These simple moments are what we are fighting for. Every breath you take in the Penumbra protocol is a ticket to more moments. You are now armed with knowledge. You are no longer helpless. You have a plan. You have a strategy. You have control. Print this protocol out. Stick it on your fridge. Make it visible so that in a moment of chaos you see the path. And always, always call for help first. This protocol is the bridge, not the destination. The hospital is the destination. Let the professionals take over once they arrive. Your job is done. You have successfully managed the most critical minutes of the crisis. From Dr. Tucker, Dr. Hinohara, and all of us here, we wish you health, longevity, and peace of mind. You are ready. Every sunrise is a gift. Protect your capacity to see it. Protect your brain. Thank you for trusting us with your time. Please share this video. You might save a friend, a neighbor, or a parent. Knowledge grows when it is shared. Subscribe to Prime Senior Living for more life-saving insights and wisdom for your golden years. We are here to support your journey. We believe that your senior years should be your best years, safe, healthy, and full of joy. Let's make that a reality. This has been a Prime Senior Living production, dedicated to the health and dignity of seniors everywhere. Be well, my friends. Thank you for watching. Remember the penumbra, remember the breath, and remember that you have the power to save yourself. Goodbye, Prime Senior Living, wisdom for life.